Bony palpation around the hip includes the greater trochanter. It is on the lateral aspect of the femur, distal to the iliac crest, lateral to the gluteus maximus. You'll find a bony prominence. To confirm the greater trochanter, you can flex the knee and internally and externally rotate the hip. And as you do that, you will feel the trochanter move underneath of your fingers. The ischial tuberosity is on the posterior aspect. You will come up the midline of the femur underneath the glute max, dig in with your thumb, and you'll feel a bony prominence right underneath of that. If I go too far lateral, I feel more soft tissue. If I go too far medial, I feel soft tissue. I'm looking for the hard bony prominence right underneath of my thumb to be the ischial tuberosity. In supine position, we can find the iliac crests again. Drop off those iliac crests, index fingers are on the crests, thumbs find the ASIS, the bony prominences and little ledges on the anterior aspects of the ilium. From there, as I go medial and slightly inferior, I am on the ilioinguinal ligament right there, and I can feel it. It runs this direction, and I am running perpendicular to it. I can feel that underneath my thumb. The adductor longus borders can be found on the medial side of the femur. They are below or posterior to the sartorius and the quads. So I can palpate it here. As I have them resist into adduction, that muscle is right there. The lateral femoral triangle is made up of the sartorius, the tensor fascia lata, and the rectus femoris. The sartorius will flex the knee, flex the hip, externally rotate the hip, and abduct the hip. And you can see that visually right here, and this comes down towards the knee. The tensor fascia lata will flex the hip, internally rotate, and abduct, as well as extend the knee, and you can see that laterally out here. The rectus femoris will flex the hip and extend the knee, and it's the more anterior muscle. The three muscles then make the border of that lateral femoral triangle, which is right here, and the divot. The medial femoral triangle is made up of the sartorius muscle, the adductor longus muscle, and the ilioinguinal ligament. Inside that triangle is the femoral artery. On a patient, we will find the ASISs. As you come off the ASIS, you'll find your ilioinguinal ligament, as we did previously, as well as the sartorius muscle, which will flex the knee, flex the hip, abduct the hip, and externally rotate. Once you are in that triangle of those muscles, you can confirm the location of the triangle by feeling the femoral artery underneath your fingers. You'll feel the pulse.